Good afternoon, ladies and gentlemen. My name is Chang Hun-ho from Seoul National University Pundong Hospital. Today I'm going to talk about the laser-powered microjet injection for drug delivery. Everybody knows what is a skin barrier. The skin barrier looks like the brick and mortar structure, and it inhibits delivery of a substance, especially hydrophilic substance, into the skin. So the problem is we would like to make a drug delivery through the skin. So it is not easy to make any drugs to deliver through the skin. So we would like to enhance the transdermal drug delivery. So this kind of a system is a transdermal drug delivery system, including structure-based and electrical-based and velocity-based method. So there's several multiple injection techniques. So you can use it with manually or the mechanical like a mesogun, or you can use air and gas injection. So this is a comparison table of the mechanical injector and the air gas powered needleless injector and the laser powered needleless injector. That is the device that I would like to introduce to you. And the laser-powered needleless device, the speed is 40 shots per second. And we don't need any anesthesia. And the depth of the injection is superficial and the deep depth according to the shot number and according to the diameter. And the volume is very precise, 0.3 microliter per shot. But it does not have any tissue dissection effect. And today I would like to show you what is this device and how this device is made. And this device comprises of the main body and the handpiece. So this is the system. So this system is included with the main body of the laser and this handpiece. I will show you the history of a Microjet and how it can made and how it works. And this is the history of a Microjet nozzle. The system is developed from the Jack Yeo from in 2008. He is a professor of the SNU, Seoul National University, the Aero Engineering Department. And he started with the study with the laser can act as a syringe. And he published several journals. And the system is developed and made by JSK Bio, and it developed much and adapted with each kind of laser. So JSK Biomed has several patents, including the Korean patent and also US patent also. The laser power injection system is made like this two-room system. The upper room has a water room and the lower room has the drug reservoir. So between these two rooms, there's some membrane. So the upper room, laser was focused on the upper room and exploded. And with the pressure of that explosion, make a push down the membrane and the reservoir the drugs inside of the drug reservoir was released with because of this pressure. The speed is too fast. So when after the explosion of the laser, about the 100 microsecond after, you can see microjet production. So we can test with the pig skin. So you can see here the ink delivery was successfully through the pig skin. And we have a gelatin test. You can see here that this beautiful, constant injection is made. You can see here the mini pig test. You can control the depth of the injection. So if you use the minimum power, the injection is the superficial depth, and you can increase the power. The injection depth might be increased. We have a test with the ultrasound image with the human skin. You can see here the the injection was made. And this is the OCT image. From the top view, you can see here the fan-shaped injection is made. We have tested the jet stability, and you can see here the jet stability test. The jet is continuously and stably made. We have compared with the laser injector and the air injector. You can see here with the laser injector, this device, the injection is constantly and constantly made depth. But with air injector, right side air injector side, you can see here the depth is not constant. Sometimes it is deep enough and sometimes it is shallow enough. And also, if you compare with the diameter of the inlet, diameter inlet with the laser injector side is very beautiful and surrounded. And but the air injector side, you can see here the inlet is the short. We have checked the temperature because if you would like to deliver botulinum toxin or any kinds of the protein, the temperature, constant temperature management is very important. So we have tested the drug reservoir temperature, and every time we shot, so the temperature is always constantly below 40 degrees. So there's two types of shots. The one type of shot is a moving shot. The other type is a stacking shot. Moving shot is a move and slide method, and each shot is made one site per one shot. But the stacking shot, if we do the stacking shot, we hold this device and make several shots, maybe 3 to 5 shots per one side. This is a skin change after the injection. So we have, if you tested the moving shot, 10 Hz. So you can see here a little bit tiny the wheel is made. But if we make a 40 Hz moving shot, this tiny wheel doesn't make. And if you do the moving shot, and if we can see the change of the moving shot and stacking shot. This is a moving shot over 10 Hz. You can see a small wheel is made, but this is a stacking shot. So the wheel size is a little bit bigger. So that means more injection fluid can be injected into the skin. This is a downtime after the injection. So left side is the air injector side. You can see here very big wheel is made after the injection. But the right two picture is right after the injection and the day 3, on day 3 of the injection. On day 3, a tiny blood clot can be seen, but generally it is good. This is my photo before and after the botulinum toxin injection I was. So I have tested with the botulinum toxin. This is the right side. On the right side only, we have tested with the botulinum toxin and with the moving shot. You can see a right side on the day 5. The right side of the forehead wrinkle is diminished. So on the glabellar area, I did the stacking shot. So this is my picture, before and after picture. And you can see here, the glabellar wrinkle is diminished after stacking shot. So here's another picture of Dr. Seo, and he do many trial with the acne scar. This acne scar is treated with PDLA, and this is a before and after picture of the after 3 months after 3 treatment of PDLA. You can see here atrophic acne scar is improved after the Microjet injection. We have adapted to the office scar. This is before the office operation scar on the eyebrow. This is right after the operation. This is after the operation. You can see here the scar is diminished after the Microjet treatment. And we can adapt the skin booster spraying technique. So you can inject like a measure gun, or you can inject the patient face with a measure gun or manual technique. But we can make some skin booster with a spraying technique. And this is after the picture. You can if you use the whitening agent, you can see here the melasma can be improved, and you can see here another picture. The skin pigment is greatly improved. And you can see here the skin texture, skin pore also greatly improved with the skin booster treatment. You can see here, you can see the great improvement the skin texture and the pigmentation. And we also adapted the stria distensia treatment. You can see here, we can treat the patient with a stacking method or moving method, or we can combine together. This is a before and after photo of the strategy. You can see it greatly improved with the 3-time treatment of the PDLA with the Microjet. This is a leg, the posterior leg. You can see here the whitish stria distensia also improved. This is a hip side stria distensia. You can see here greatly improved, and the white stria distensia can be seen. So I have introduced this device for many times on the ISDS and ASDS and ASLMS. Thank you for your attention. And I show you how to treat the patient, and I will show you the live demonstration. And I will show you how the Microjet system works. And this is the Microjet nozzle. And you can unpack the Microjet nozzle, and the pack is looks like this. And the Microjet nozzle has 3 types. According to the diameter of the nozzle, the 150 micrometer, and the 200 micrometer, and the 250 micrometer. 3 types of nozzle exist. And I will use the 250 micrometer size diameter Microjet nozzle today. And the nozzle looks like this one. You can see here, upper part is a water room, and the lower part is a drug reservoir. Between these 2 rooms, there's a membrane. So the laser system is focused on this upper part, and then explosion of this upper part of water makes the pressure. This pressure pushes the membrane downward, and the nozzle, the drug inside of this drug reservoir can push down here. And you can use this type of the drug, any kinds of drug can be used. We have tested with the PLA and many kinds of the HA, and also calcium filler also. And today I will show you with the simple, the normal saline, to how to use these kinds of the Microjet. And when you install the syringe, and we usually use a low-rock syringe. And you can attach this low-rock syringe with this. And then if you push the syringe, you can see here the drug is out. That means this drug reservoir is filled with this drug. And then we can attach this to the laser handpiece. After we attach this tip to the handpiece, we should remove the airs inside of this drug reservoir and the syringe. So you should hold the handpiece to the upward and make a shot. But before the make shot, you should make sure the power is maximum. Because if you make a power maximum, it is easily to make fill the drug reservoir easily. So hold the handpiece upward and then push the put button. You can hear the sound is changing. So that means this drop reservoir is filled with this drop. So every air is go out, and then you can reduce the power according to your treatment. So this patient has some atrophic acne scar. So I would like to treat him with a stacking shot after dressing with the alcohol swab, and then I will make the stacking shot on the atrophic scar region. You can see a pinpoint bleeding here, and then some small wheel is made here, like a white heel is made, and a small pinpoint bleeding here. I have treated him several times, but he has a much improved acne scar, but some pinpoint remaining acne scar here. Please turn down. Okay. And actually, this patient we do not have any anesthesia. But sometimes, if you can use the topical anesthetic cream, will be help to reduce the tingling sensation. Okay. The treatment is very simple, and if you touch the hand piece onto the skin and just push the put button, and the jet is made like this one. Okay. So this patient has a little bit freckles on the cheek area, so I will use the skin booster with some depigmentation agent with a moving technique. So I make for 40 Hz moving technique, and then you can see a very fast jet is made, and then clean the skin with the alcohol swab, and then the treatment is very simple. Just fastly move, because it is a 40 Hz, no feel is made, but the agent is delivered into the skin, and you can see the effect. Any kinds of if you use the whitening, the agent, you can see the effect within 3 to 4 weeks. After the injection, the skin shows a little bit the erythema here, but there's no bleeding or no downtime. If you would like to ensure the delivery of any kinds of the injection solutions, you can repeatedly the injection with this Microjet. The same spot with this direction again, and then round. Today, it is great honor to introduce you on the eAsia on this system. Thank you for your attention.